The House kickstarts the budget reconciliation process. Physician lawmakers introduce Medicare reimbursement reform legislation. And the text of a government funding bill is released. For the week of July 20th, 2026. From Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth. Kicking off this week's episode with news from Capitol Hill, where the House of Representatives passed a $47.3 billion national security, Department of State, and related program spending bill in a 217 to 209 vote on Wednesday. The fiscal year 2027 appropriations bill represents a 6% reduction compared to fiscal year 2026. It includes nearly $8.9 billion in global health funding, $532 million below currently enacted levels. The President's Emergency Plan for AIDS Relief, or PEPFAR, would receive $5.5 billion, while the Global Fund to Fight AIDS, Tuberculosis, and Malaria would receive $1.25 billion. The House rule for consideration of H.R. 8595 added the text of the Save America Act upon passage. On Friday, House Republicans released the text of a stopgap spending measure to extend government funding at current levels until after the November midterm elections. The continuing resolution would fund the government through December 4th. The chamber is expected to consider the measure on the House floor this week. Congress faces a September 30th deadline to pass a funding bill and avoid a government shutdown at the end of the fiscal year.
Current resolution on the budget for fiscal year 2027, which is the first step to unlock the reconciliation process.
Republicans on the House Budget Committee voted to approve a budget resolution along party lines on Thursday, completing the first step towards advancing the third budget reconciliation package of President Donald Trump's second term in office. The $95 billion budget blueprint does not contain instructions for the Energy and Commerce or Ways and Means committees, the key panels with healthcare jurisdiction, meaning major health provisions or offsets will not be included in the eventual budget bill. The next reconciliation package is instead expected to focus on defense spending, aid to farmers, and voting integrity. Due to the narrow focus, House Majority Leader Steve Scalise, a Republican from Louisiana, said they are already, quote, looking at Reconciliation 4.0 to do the things that are left out of this one. Representatives John Joyce, a Republican physician from Pennsylvania, Greg Murphy, a Republican physician from North Carolina, and Kim Schreier, a Democratic physician from Washington, along with 24 other members, have introduced a comprehensive bill to reform the Medicare Access and Chip Reauthorization Act, or MACRA, titled the Patients First Act. The legislation would tie physician reimbursement to an inflationary measure. It would establish a primary care hybrid payment pilot program that pays primary care providers a per-member, per-month payment along with regular services. It rebrands the Medicare Quality Payment Program and transition to the Patient Outcome Improvement National Tabulation System, or POINTS, and establishes a physician and clinician-led task force at the Centers for Medicare and Medicaid Services to develop quality metrics. It would freeze advanced alternative payment model participation thresholds for 3 years and create notice and comment periods for the Center for Medicare and Medicaid Innovation mandatory models. Finally, it would increase the budget neutrality threshold from $20 million to $57.64 million.
How health insurance racked up billion in extra payments from Medicare Advantage. I'd love that submitted for the record. It shows how, especially United Health Group, I'm calling them out and I'll continue to call them out.
Without objection, sir.
There's some people that are probably going to end up going to jail because of the way they've ruined the system. The second thing is
in an op-ed published on The Hill on Monday, Representative Greg Murphy, a Republican physician from North Carolina who co-chairs the House GOP Doctors Caucus, called on Congress to take action regarding the health insurance industry, highlighting that the 7 largest for-profit insurers made nearly $1.7 trillion in total revenues, representing at least $54 billion in profits last year. He specifically takes issue with the practice of stock buybacks, arguing that when insurance companies use excess profits to buy back their own stock, quote, it augments the upward spiral of patient financial distress as they try to pay for health care, unquote. Representative Murphy also acknowledges that increases in prior authorizations and claims denials make care more expensive and harder to access, while tying the, quote, explosion of vertical integration and its subsequent price tag, unquote, to the establishment of the Affordable Care Act's health insurance marketplace. Last week, the House Ways and Means Committee favorably reported 7 pieces of health legislation. 6 out of the 7 bills were advanced unanimously. The Health Care Price Certainty for All Americans Act was passed in a 25-15 vote. Also on Wednesday, the House Energy and Commerce Committee advanced 3 bills by voice vote aimed at addressing existing and emerging illicit drug threats. Those included the PRESS Act, the Stop Pills That Kill Act, and the Fight Illicit Pill Presses Act. Senate Republicans voted down a Congressional Review Act resolution on Thursday that would have prohibited implementation of the Centers for Medicare and Medicaid Services Wasteful and Inappropriate Services Reduction, or WISER model. The resolution failed in a 46-50 vote. The WISER pilot program, which launched on January 1st in Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington State, uses artificial intelligence to apply prior authorization for 13 medical services deemed low value or vulnerable to misuse in the traditional Medicare program. The model is set to run for 6 years. The House of Representatives postponed a planned vote last week on legislation to overhaul disability, health care, and other benefits for veterans. The package included the text of more than 60 bills, many of which had bipartisan support. Some lawmakers on both sides of the aisle, however, expressed concern about the proposed offsets that would have reduced benefits for sleep apnea and tinnitus. House Speaker Mike Johnson has stated that Republicans will work further on the bill and bring it up again after the chamber's August recess. Winding down today, where the Government Accountability Office, or GAO, released a report last week detailing the need for stronger controls to prevent unauthorized actions by agents and brokers in the federal insurance marketplace. The report finds that the Centers for Medicare and Medicaid Services' existing safeguards do not always protect consumers from unauthorized activity by unscrupulous agents and brokers, such as fraudulent enrollments or plan switching without consumers' knowledge or consent. The number of consumer complaints of unauthorized enrollments and plan switches increased from approximately 66,000 in 2023 to 299,000 in 2025. GAO recommends that CMS design and implement stronger controls to verify consumer consent to agent and broker actions on consumer enrollments, restrict access to consumer information to the agent of record, and notify consumers of agent and broker activity on their federal marketplace enrollments. Final news today, where South Carolina Governor Henry McMaster, a Republican, has appointed Darline Graham-Nordone, Lindsey Graham's younger sister, to serve the remainder of the late senator's term. The special Republican primary to fill Graham's seat must be held by August 11th, and candidates can formally file to run between July 21st and July 28th. While Darline Graham has not yet announced whether she will run for a full Senate term, she's already received the endorsement of President Donald Trump. The eventual Republican nominee will face Annie Andrews, a pediatrician and professor at the University of South Carolina, who won the Democratic primary in June.
Good morning, and welcome everyone to the organizational meeting for the 119th Congress.
And I welcome everyone to the first HELP Committee meeting of the 119th Congress. Good morning and welcome everyone to the first meeting of the House Committee on Energy and Commerce of the 119th Congress.
The Finance Committee will continue its long tradition of addressing these matters in a manner that invites bipartisanship.
We end each week's episode with the Call to Order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, on Monday, July 20th at 5 p.m., the House Energy and Commerce Committee hosts a markup of 29 bills, including the Lower Costs, More Transparency Act, the Improving Seniors' Timely Access to Care Act, and the Biosimilar Red Tape Elimination Act. Second, on Wednesday, July 22nd at 10 a.m., the Senate Health, Education, Labor, and Pensions, or HELP Committee, holds a markup of 13 health bills, including the Empower for Health Act and the Title VIII Nursing Workforce Reauthorization Act. Third, on Wednesday, July 22nd, the House Oversight and Government Reform Committee convenes a markup that will include the Pharmacists Fight Back and Federal Employee Health Benefit Plans Act. The time for this markup has yet to be announced. Fourth, on Wednesday, July 22nd at 4 p.m., the Senate Veterans Affairs Committee gavels in a hearing titled Advancing the Mission, Evaluating the Future of VA Research. And last, on Thursday, July 23rd at 10 a.m., the Senate Help Committee hosts an executive session to consider the nominations of Sean Kaufman to be Assistant Secretary for Preparedness and Response for the Department of Health and Human Services, Erica Schwartz to be the Director of the Centers for Disease Control and Prevention, and Keith Sonderling to be Secretary of Labor. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.